So our next speaker is Stan Holt. Sorry, I invited him. Stan Holt, who is the Vice President for Community Impact at the United Way of the Greater Triangle. And he's going to explain to you his own past and how it fits with what he does today. Stan.
So I'm going to try to work here with this computer and do stuff on the screen. I've actually been at United Way now 8 years. Prior to that, I was the director over at Genesis Home for about 9 years. And I've been working with communities of poverty for...
Use the mic. Some of us can't hear it.
Okay. All right. I'll do that. Will it travel?
It can. I'll have to travel. There we go.
Okay. Better? All right.
Thank you.
Okay. So I've been working with folks who are living in poverty for, 15, 16 years. And one of the things that we do at United Way is that we invest money in programs that are really trying to help those who are living in poverty. We invest money in programs that help children with regard to education. We invest money in programs that are related to health. And we invest money in programs that are associated with housing and food distribution. And we do that in Wake, Durham, and Orange counties. And we've had a long history of doing that work. And one of the things that those investments are, the decisions about those investments are made by volunteers. They're not made by a staff. Those volunteers, though, look at the kind of, what I would say, variety of data that's out there around what the needs are in the community. And so when I was asked tonight to talk, they said, well, why don't you bring some of that data? So I'm going to bring some of the data that we work with at United Way and kind of share some of that with you. It can be kind of boring. I'm going to try not to make it boring. But you've kind of heard Mel allude to some of this that we have seen over the course of the years. So I'm going to just go ahead and jump in and talk about a definition of poverty here. Hopefully there we go. One of the things that Mel talked about was this notion of the Circles program, which has been being used in other communities across the country. And it's based on the work of a woman named Ruby Payne. And she really takes this notion of poverty and she talks about it and she defines it as the extent to which an individual does without resources. Now, this is kind of an important thing because what she talks about is resources in terms of more than just finances. Right? When we think of poverty, we think of money. Well, she's saying, no, it's not just about money. There are a whole host of other resources that, as people do without those, that creates and puts people in a situation where they don't have the resources they needed. So certainly she talks about the financial. She talks about the emotional need, the ability for people to really persevere, to deal with the challenges on a day-to-day basis. She talks about the ability to process information. She talks about the ability to actually have a sense of spirit as people. And if you don't have that kind of connection or access to that kind of community, that can lead to being without certain resources. Physical health, other support systems, role models and relationships. I think that was a thing that you heard Mel talk about. Really important here. The knowledge of the hidden rules. And this is an interesting thing. when she, in her book, she really talks about the rules of wealth, the rules of middle class, and the rules associated with low-income individuals. And there's different standards and so-called social rules within those different categories. And then she talks about the notion of simply being able to cope. If in fact you are better able to cope with your situation, to think things through, you're able to kind of move out of poverty. So I think that was a really kind of nice way to think about this from a holistic perspective as she kind of defines this stuff. But let's talk a little bit about the numbers, about what it means to be living in poverty. So what we know is that for a family of four, that's four folks, that's about $23,000 a year or $1,900 a month. For a family three, about $1,500 a month, and for a single person, that's about $11,000 a year. And I want to talk about this notion of poverty for a minute, because what happened in 1963 is that this is the first time they used a number that was basically a third of what people spent on their food to create the poverty level. And then subsequently, they have just adjusted the poverty level up every year based on the cost of food. Now, what's missing in that?
Everything else?
Everything else. And what the reality is, housing is one of the most expensive pieces of our own, one of the biggest pieces of expenses, and it's not even part of the poverty level. So there's a movement out there to really kind of think about, here's this definition and it's just antiquated. We really need to rethink this. So it doesn't include food. It doesn't include housing, childcare, healthcare, transportation, some of those basic needs. So this is an interesting thing. Hopefully you can see it, but what we do is we start with $1,900 a month, and then we start saying, okay, what does it cost, right? So we look at rent for a 2-bedroom apartment for that family of 4, and we know in the triangle that's about $700 a month. So that leaves us $1,200. When we look at the average utility cost, that's all utilities combined, and that particular number is a national number. It's $250 a month, leaving us $900. When we subtract transportation costs, we're down to $600. When we subtract cost of food for a family, we're down to $71. So there you have it. You're basically your place to live, your transportation, and your food leaves you $71 a month. So what do you do for childcare? It puts you in the hole. What do you do for healthcare? And then what do you do for things like school clothes, work clothes? What do you do for birthdays, Christmas, those kinds of things? And so it's I usually do this as an exercise, but and have everybody kind of play with this. But I think this is really, it's really profound when you start thinking about this. A family of 4 having to make ends meet on $1,900 a month. It's virtually impossible. So what people are talking about is this notion of a living wage. And the group that's beginning to really talk about this, and has for some time, is the North Carolina Justice Center. And they have determined, they take all those pieces, right? They take the child care, transportation, housing, and they put that into these nice spreadsheets, more data, and they say that it probably really costs about $48,000 a year for that family of 4. Yet, What did we see? Poverty's half of that, less than half of that. So when we think about what it costs to live in this area, this is what we're really looking at. What we can do to really begin to help people access and build that living wage. Here's the numbers. We start looking, and different, one of the things that you'll need to know is that different sources will come up with just slightly different numbers, and so it gets really confusing. So this is the best this is some of the stuff that we use at United Way, and I've tried to kind of document where I've got most of this information. 46 million people across the country, 1.6 million in North Carolina, 200,000 across the Triangle, 70,000 under the age of 18, 34% of those in poverty, 19% of all those under the age of 18. So that's some of the data there. Yeah. Here's some information. The data tends to lag. So some of the most recent stuff that we had, we saw in 2010 overall across the country, we reached a high in almost 52 years. And that basically didn't change much in 2011. The thing that did change in 2011 was that the number of uninsured folks dropped, and that was a lot as a result of the Obama healthcare plan. You actually started seeing some of those folks who were uninsured start getting health insurance. Here's the Durham numbers, and I think that we've got 267,000. Our poverty rate's about 17%. Under 18 is about 23. Mel, yours is 27, but I think that's for the younger children, right? No?
Up to 18.
Okay, so this is where that gets the source is a little different. 65 and over is 8.2. One thing to remember about those who are 65 and older, it used to be that number was like 23, 24% back in the early 1960s. And what happened? Social Security, Medicare. All those things are strategies that are at the public policy level that really impacted that poverty rate, and we don't have those same kind of public policies at the federal level for young people, for kids. So that's a real, so if you think about that, that's a real important thing to think about. The other thing that's important to look at is the race in poverty. When we look at the inequities associated here, 42% of our population is white, 7.9% of those in poverty are white in Durham, 38% of the population is black, 22% of those in poverty are black, 13.5% of the population is Hispanic or Latino, and 31% of those in poverty are Hispanic or Latino in Durham. So one of the other things that we know is that poverty impacts health, it impacts education, and vice versa. So it's this loop, right? It's health, it works both ways. And what we know when we start looking at health, we start seeing that poverty doesn't allow people to access good food, less heat in the winter. Preventive services are not accessed by those who are in poverty. A lot of this stuff was pulled from kind of different resources around some kind of academic studies that were done around poverty. So we've just tried to kind of summarize what we see here. Higher rates of illness and death. Folks live in unsafe neighborhoods. Lots of worry, stress, and depression associated with that. We know it impacts education. It impacts the social and development the intellectual development of kids. They don't pick up the vocabulary. They don't recognize their numbers. So those are elements that happen with regard to education. We know that young people in poverty are more likely to drop out of school and less likely to go to college. So those are all kind of impacts associated with poverty. This really talks about that what they also know is that there are different things about poverty, different nuances about poverty that impact the readiness of those who are in school. And when you look at, for example, the particular age that some people experience poverty, those kids at the younger age are much more susceptible to the social and cognitive challenges. As you grow older, and if you experience poverty later, you have better coping mechanisms, right? So you're better able to deal with those things. And these are just some of the things that it talks about. If you've experienced poverty a long time, that really affects your ability to be ready for school. You know, one of the things that I like to talk about is this notion of wicked problems. And a wicked problem is a problem that has an incredible number of factors that play into it. And poverty is one of those. And it requires a whole bunch of different kinds of solutions. Yeah. You know, it just does. And your points about different strategies are so, it's true. There's gonna have to be public policy strategies. There's gonna have to be human service strategies. There's gonna have to be any number of strategies to really weave the net to create some success.
And I don't think we're gonna solve those issues tonight. Those are wonderful points. But I think other forums, maybe in Poverty Durham, is a place to start where people coming together, and you'd be welcome to come, I think, to the meeting tomorrow, Bill mentioned. So that would be terrific if you wanted to come to that. I didn't mean to cut you off.
No, that's fine.
Okay.